And you mentioned that you were able to secure the first license to import into Australia. Since then, have there been other import licenses granted for?
Yeah, there's been a number. We were the first. The very close second was another Canadian company called Tilray. We imported Canamed from Saskatoon. And there's been a number of Canadian LPs put products into the Australian market. You guys have been doing it a long time. We've got a lot of expertise in that area, so we're learning from the best. There's a lot of interest from Canadian companies in Australian cultivators as well.
Right. And right now you said there's only one licensed producer in Australia?
No, there's one with product to market. But it's probably one of, I expect, about 20 that will have product over the next 5 years. It is a bit of a process. It's very easy to grow cannabis small scale, a lot harder to grow it on a bigger scale. Then you've got different methods of extraction, formulation. It takes a while to get product to market. We're currently only allowing GMP cannabis. Most of the doctors are favouring concentrates, i.e. non-smoked cannabis, so things like oils, capsules, tinctures are really, really popular. And we're looking at a pharmaceutical elegant product. The Australian government is making sure that the standards are kept up as far as having a GMP product.
And what do you see as the future for the industry in Australia outside of the growth to Asia and maybe even South Asia? What about within Australia and I guess New Zealand being your close neighbor? What do you see as the growth in the industry there in terms of the producers and the dispensaries and the whole abstract of the industry, not so much on the patient side?
Yeah, so I think our industry has got some really positive things ahead of it as patient numbers grow, as Asia comes online. We've adopted a very medical system. The dispensary model is only really North America, particularly America. I believe pharmacies are a really good distribution model for cannabis. Most of the patients we've seen use medical cannabis are on a range of other medications, so pharmacists are really well placed to counsel patients not only on their cannabis but their other medications. They're also it's good having it available through pharmacies because health funds are more likely to subsidise it if it's seen as a medicine. What is happening, you mentioned New Zealand, they're having a referendum on adult use cannabis in a couple of years, and I believe if they pass cannabis for adult use in New Zealand, the conversation is going to be brought forward in Australia. So I know Canada's recently gone from having medical cannabis available on doctor's recommendation to adult use, and the market's expected to grow tenfold. I see the same unfolding here.